It's 7 a.m. here in Johannesburg, South Africa, and I'm a little nervous because I'm about to go in for my first HIV test.
Tell me about your sex life.
My sex life?
What?
What is the purpose of risk assessment?
Well, you're right to get an indication whether we have to expect a positive result or not.
Is there any other way that you have exposed yourself and you feel you might have contracted HIV virus since you're here?
No, I'm not gay, and I'm not a hemophiliac. I've never had a blood transfusion, and I've never used intravenous drugs. So I think it's impossible for me to have it.
What's great about a rapid test? Well, they're less expensive and they're very quick. And we know that cheap and fast is always a sign of high quality. These tests claim to be HIV tests. I'm going to read from a section that says limitations of the test. The specificity of the Reveal Rapid HIV Antibody Test for blood specimens in low-risk populations has not been evaluated. They don't know, in their terms even, how well this test is going to work in people they don't want it to work in, low risk. We don't think you're at risk.
Rapid tests in Germany, it's not allowed for standard diagnostics.
May I ask how come you don't use rapid tests for standard diagnostics?
Several professional organizations who decide as an expert committee on guidelines how to do things. None of these responsible societies recommend it for scientific reasons.
This is the language all these tests use. A reactive test result using the Reveal HIV antibody test suggests, that's nice, the presence of anti-HIV antibodies. That's good. Okay, we suggest that you're going to die soon. The Reveal Rapid HIV antibody test is intended to be used as an aid in the diagnosis of infection with HIV. But it's the test. I thought it was an HIV test. No, it's just it's a helper. How does it help? Here's how it helps. Results of the MedMirror Reveal test should not be used in isolation, but in conjunction with the clinical status, history, and risk factors of the individual being tested.
How do you decide how to interpret as a technician? What do you do?
I will ask in addition, is there a pregnancy? Is there any allergy known? Is there additional information to have more information on if it could be cross-reacting antibodies or true infection?
The problem is that we can't distinguish between a false positive and a true positive HIV test. The tendency is to call it a true positive if somebody's in one of the risk groups.
And for sure, the first question is there risk? This I didn't even talk about, but it's one of the very first questions. Is there risk for infection?
Okay, and is that the risk assessment section?
Yeah.
If you have risk factors like you admit to being gay and to having had sex recently without a condom, you're suddenly at high risk. And this test is very meaningful for you, say we. You come in, you're a straight guy, come from a good family, you're a little worried because you had a European fling, but she was a nice girl. Nah, don't worry about it.
So, do the answers to these questions help aid in the diagnosis?
Oh, of course they did.
Really?
They do.
This is from a journal called AIDS Alert. It's about the rapid test. If the same test was performed on 1,000 white, affluent suburban housewives, a low prevalence population, in all likelihood, all positive results will be false. If the same test was performed on 1,000 white, affluent suburban housewives, all positive results will be false. They'll be positive, but they'll be false. Why? Because we say so. That's why. We say who's positive. We interpret it our way.
It really says that?
The last bit I said. We interpret it our way.
No, but it really says that housewives?
Let me read you the whole quote. Whether the test will perform as well in the United States as they have abroad is still unknown, experts add. Well, why might tests work well abroad? Because we assume everybody who tests positive, we're just going to say they're positive. Here, it's different. For one thing, using a single rapid test in a low prevalence population will give a lower positive predictive value. that error rate won't matter much in areas with a high prevalence of HIV because in all probability, the people testing false positive will have the disease. They'll be testing false positive, but they'll have the disease. We know they have the disease anyway, and the test result doesn't matter. That's what that means in English. Welcome to AIDS doublespeak. But if the same test was performed on 1,000 white, affluent suburban housewives, a low prevalence population, in all likelihood, all positive results will be false. And the positive predictive value plummets to 0. That's from AIDS Alert magazine, Coming to Your Clinic, Candidate for Rapid Test. What that means is they look at a group and they say, there are this many people with AIDS in this area. And we define AIDS clinically again. We say that you have AIDS because we say that you fit the criteria now. And when we say that you fit the criteria, we say that the tests work better.
I know that rapid tests are used in African countries. If you have a high prevalence of HIV infections, you have less risk to pick up false positives,
Okay.
which might happen in countries like Germany with prevalence below 1%.
Oh,
So that makes a big difference in screening for HIV.
so in a low prevalence
Yeah,
group, you
because
don't want to
when
use rapid tests.
Yes, genau, because you pick up more easily the false reactives in the first assay, in the screening assay.
Okay.
The way that they pitch these tests is they try to get them to be most reactive with the people who they think are more likely to be infected. There's an a priori assumption going on. I'm going to look at the black community and I'm going to make tests, and when I test them I'm going to make sure that I get the strongest reaction for whatever reason, I don't need to know, with the blood that I draw from these various communities. The Knowing is Beautiful campaign is one of the many go get tested, it's responsible campaigns put out by little political action communities like AMFAR. And the idea is to tell everybody to go get tested, but it's not everybody. They're not interested in saying everybody. Like, for example, you don't see the big ad at the bus stop in Beverly Hills. Knowing is beautiful, be responsible. You don't see it in Chestnut Hill, Massachusetts. You don't see it on the main line in Philadelphia. You don't see it in La Jolla, California. You don't see it in Burbank. You see it where? In the inner cities. You go into downtown Philadelphia, the whole thing is like, AIDS land. You go into the Castro, AIDS land. You see so many ads for doing the responsible thing. Why? Because we believe, for some reason, that some people, when they have sex, will also die. But some people won't. We forget that there's a long history in humanity of actually reproduction. There was that thing called the Crusades where people went all the way from Europe into Persia. They had lots of sex with a lot of people. They didn't have a Knowing is Beautiful campaign. Yeah, people probably didn't have AIDS. A lot of people probably died anyway. You look at now, we have this idea that these people, these very specific people, need to get tested so that they can be sort of monitored, and we can help them, I guess, by drugging them, by offering them drugs. Yes, but we know that once they get tested, if they test reactive and we say that's positive, we know that they're going to die. We know that. So it's really a great gift we're giving, if you see what I mean. The test makers are very clear, though, that we don't want to test in La Jolla. We want to test maybe in downtown San Diego, where a lot of the young gangbangers live, a lot of the young Mexican kids live. We want to test in uptown New York in the 170s, where a lot of Dominicans live. Certainly not in the 70s, where the nice, newspaper publishers and all these sorts of cable magnates live. Do you know the one that says, "Are you positive you're not positive"? Do you know whose picture is on that? A black girl's. And a black guy's. I mean, I have him right here. Are you positive you're not positive? Right there. I'll give you the picture another time. But are you positive you're not positive? And here's one that says the new face of HIV. But it doesn't say that. It says la nueva cara de VIH. It says it in Spanish, and there's a picture of a young Latino girl. The Knowing is Beautiful campaign is an idea that somehow using tests that don't register anything specific is a meaningful thing to do to stop the problem of what we consider to be a sexually transmitted disease that's clearly a toxicological multifactorial problem. But we're very clear about who we want to have tested, and the medical literature is even more clear about it. I think I would like to ask the question, do you really believe that after these many millennia of life on Earth, in 1983 or 4, a virus came out, like a new product, that would be sexually transmitted, but only among like Latin and maybe black people and gay people?
Gay men have been targeted for testing. In other words, the general population of the United States, there has never been a mass pressure, get tested, take an HIV test. But gay men, the propaganda there is everywhere. And so, of course, the more people you have taking the test, the more positives you will get. And to me, this is a very sinister development, or a very sinister phenomenon.
The gay AIDS establishment and the medical community that serviced the gay AIDS community marketed the HIV test as the critical sign of whether you cared about yourself, whether you wanted to live or not. And it was very hard for anyone who was concerned about their health, particularly anyone who had lived any form of this lifestyle that was being called into question, to resist taking this test. You had doctors who refused to treat patients who didn't take the test. You had doctors who refused to treat people who had taken the test, who refused to take the AZT that was available. They would drop the patient. This is what the Denver Principles was about. Because there's nothing worse than having, your medical provider is supposed to be someone that you trust and that you think is going to help you. And when they suddenly abandon you because you haven't followed their direction, it changes the relationship between the patient and the doctor, because that's supposed to be a partnership. The doctor's supposed to give you his advice or her advice, and you're supposed to make a decision based upon that. And if you say no, that medical provider is supposed to respect your position. That changed with AIDS, because you were not being a good patient if you didn't do the HIV test, if you didn't do the drug at the moment that was being told. If you didn't do those things, then you wanted to die. A person who's afraid of dying, is terrified of dying, a young person, we're talking about almost all young people, who's terrified of dying, to be told, if you don't do this, you're going to die, and I don't want to have anything to do with you. That happened over and over and over again. And that's why when the PWAs nationally got together for the first time in Denver, I think it was 1986, and drew up the Denver Principles, one of the first things in those principles was we have a right to say no to our medical provider, and to be respected, and to continue to have a relationship with that medical provider.